Okay, good afternoon. This is voting list number 2. This is our second voting session. And we are going to take up 2, 4, 6, 7 bills, and then we'll have 2 bills that we'll also take up fairly quickly. We're going to start with Senate Bill 168, which is Maryland Developmental Disabilities Council establishment. Nathan?
Yes, ma'am. Senate Bill 168 codifies the Maryland Developmental Disabilities Council as an independent unit of state government. So currently the council operates under the Department of Disabilities, and it was established by executive order rather than through statute. The council operates and receives its funding in accordance with the Federal Developmental Disabilities Assistance and Bill of Rights Act of 2000. The bill establishes the council's duties, membership, staff, and requires that the council adopt bylaws, policies, and procedures that comply with state law and the federal act. There are no amendments, no fiscal impact, and no opposition.
So I'd entertain a motion.
Second.
Have a motion and a second on the favorable. Are there any questions on Senate Bill 168? Any questions? All those in favor indicate by saying aye.
Aye.
Those opposed, raise your hand. That bill receives a unanimous favorable report. We'll now turn to Senate Bill 200. Nathan.
Senate Bill 200, a reprint of which is before you, authorizes the State Board of Chiropractic Examiners to deny a license to an applicant or take specified actions against a licensee, including suspending and revoking a license if the applicant or licensee fails to comply with any board order. The bill specifies that an order of the board may not be stayed pending judicial review, and authorizes the board to appeal any decision that reverses or modifies its order. If a license is suspended or revoked, the board is authorized to reinstate the license only in accordance with the terms and conditions of the order of suspension or revocation, or by an order of reinstatement issued by the board. There's an amendment on page 2 of the reprint offered by the bill's sponsor, Senator Lamb, which addresses concerns raised at the hearing. The amendment authorizes the board to grant a stay of enforcement of its own order in accordance with the Administrative Procedure Act. There's no fiscal impact and no opposition at the hearing.
Okay, discussion, Senator Reedy.
Verifying, this is similar. There's many other boards that have this authority. It's just bringing them in line, correct? Okay.
Any additional questions or discussion? Is there a motion? Senator Lamb moves favorable. Is there a second? A favorable with the sponsor amendments and a second. Thank you, Senator. All those in favor of Senate Bill 48 favorable with amendments indicate by saying aye. Those opposed, raise your hand. Seeing none, that bill receives a unanimous favorable report. Thank you. We'll move to Senate Bill 231, Maryland Medical Assistance Program Autism Waiver Military Families. Nate.
Yes, Senate Bill 231 requires that a child on the registry for the waiver for children with autism spectrum disorder, and that's also referred to as the autism waiver generally, that those children remain on the registry if the child's family relocates out of the state for military service. If a child on the registry becomes eligible for services while the child's family is out of the state for military service, the child must remain eligible for services through the waiver if the family relocates to the state. There is an amendment Senator Hester has asked to be added as a co-sponsor. There is no fiscal impact and there was no opposition.
Okay, is there any discussion? I don't see any reason why not. If you'd like to pile on as a co-sponsor, anyone that wants to be a co-sponsor, raise their hand.
I'll be on it.
Maybe I should say anyone who doesn't Did you get the names? Do you need it? Do we need to do it again? It's everyone. Okay, well then I guess I'll entertain a favorable motion with a sponsor amendment. Motion and a second on the favorable. All those in favor indicate by saying aye. Those opposed, raise your hand. That bill receives a unanimous favorable report and sponsorship. All right. Okay, we're going to move to Senate Bill 48, Disaster Service Uniform Service Leave Modernization Act, and that's David.
Okay, you heard this bill last week. It's again, as the title that the chair just went through. The bill does 2 or 3 things. The first thing it does, and you have a reprint in front of you because the sponsor has offered amendments to the bill. So the first part of the bill is it adds a definition of as introduced, local emergency manager to the part of the code that deals with Department of Emergency Management. And Senator Lamb has offered an amendment which was suggested by Mako to change it to emergency manager and not local emergency manager, because that's how these folks are generally referred to. And then we move on to page 3 of the bill, and this is where you'll get into the modernization part of the leave. Most of this bill deals with state employee leave, and there are several types of employee leave available for emergencies and also for military personnel. All of these leaves are paid leave. So if you go to page 3 on the bottom, there's a section of leave that that's been around for many, many years that provided if you're a member of the American Red Cross, you would be able to take leave for a certain type of disaster as designated by the law. The bill would expand the types of disasters to any disaster and would authorize any state employee who is a member of one of these organizations to take up to 15 days of disaster leave. There's also an amendment offered by Senator Lamb to expand the types of organizations who are the types of organizations a state employee could be a member of, so they can take this disaster leave. And it also authorizes that if under the certain circumstances, the leave could be expended, so these people could still be out there serving or providing services during the disaster. If you go to page 5 of the amendment of the bill on the reprint, there's also a leave for folks in the uniformed services, which is the classic, what you would think of: Army, Navy, Marines, Air Force, Coast Guard, that they would be able to take paid leave for training purposes. It adds all the uniformed services to who might be able to take leave for these training purposes. So that's on page 5. And on the bottom of the page through page 6, during I believe the second Gulf War, there was a type of leave established that would allow folks in the uniformed services who are deployed to take this leave, and they would get the difference between their military pay and their current state paycheck. So if they're on leave serving their country after being deployed, they wouldn't lose any benefits or any pay because they happen to be getting paid less for being in the military. So that's what this is about. And it would also add all the uniformed services to this type of deployment leave, so they could get that difference in pay, so they would not lose any pay, any pay they're getting as a state employee because they happen to be deployed. So those are the changes to the bill, and with the amendments, it also specifies, well, there's no amendments there regarding uniformed services and who we're talking about here. And I think Senator Lamb may have an amendment to his amendment.
So I'll try to explain this as cleanly as possible. So on the reprint page 2, paragraph 2, where it defines emergency manager, there was a suggestion to bring it up into a definitional part of the statute. So 14-101, where there's a whole bunch of definitions spelled out.
Mhm.
The reason being is that in here, 14-104.1 is actually specific to the cyber preparedness unit. And so bringing the definition up to the higher definitional part of the statute that already exists allow other elements when it comes to like EMTs and other emergency management personnel to also be able to use that definition, the emergency manager definition.
It would apply through the entire title rather than just this section.
Right, and this section is just the cyber kind of section.
And I think there's also, and I didn't get a chance to get this, but they want to add, Senator Lamb was also going to add an additional group here under, if you go to page 4, these groups that who can take the leave. There's another group that to be added there. I can't remember the name.
It's the community organization active in disaster.
So we just add an additional group here that a state employee could be involved with and access this type of disaster related leave.
And the reason is that we had heard from some counties that said they believe what we added with Maryland Voluntary Organizations Active in Disaster would cover them, but they wanted to make it airtight. And that's why they were suggesting adding number 9 under Roman numeral number 8, a community organization active in disaster.
Senator Hayes has a question and then Ellis.
Do we have these amendments that we're verbally discussing?
No, I did not get a chance to get to draft new amendments, so.
Okay.
But as Senator Lamb said, it's the same definition. It's just going to be in a different part of
Heard you to say that we're expanding the number of personnel that might be able to benefit.
another group will be added to the list you have on page 4 of the reprint.
Right. I would just have some uncomfortability on voting on something that I haven't had a chance to review in front of me.
Understood. Senator Ellis.
Thank you so much. So this bill only applies to state employees.
Yes, it only applies to this is leave for state employees.
Yeah.
So only state employees can have access to this leave. It has nothing to do with any other type of local employee.
Okay, yeah, I'm kind of curious because Mako and the counties weighed in on this. So what's their interest in a lot of these things? They possibly.
We want to be able to have employees that may be dual, like working for both to be able to qualify. I think that was the only thing that occurred to us on the local level, right?
So for state employee also working for the county, is that what you just said?
I think it's a little, the idea as I understand it is these Mako draws a lot of these employees or the locals use a lot of these employees for disasters.
Okay.
And so the more employees you can, who have access to this leave, that allows all these employees to go help out the locals when there's a disaster in a local, in one of the counties.
Yeah. And so one question, since we expanding the number of organizations, is there a straight definition of what's classified as a disaster as be declared by the governor or FEMA? Is that anywhere? I couldn't find it really quick enough.
The disaster that the Red Cross can use is specified. Otherwise, it would be, I would imagine it'd be a disaster declared by the governor under the public safety article.
So that would be clear as far as
I'm reasonably certain the department would not let anybody take leave unless there was a real disaster out there, because you'd have to get approval from your supervisor to take this leave.
Okay, thank you.
All right. So if there are no questions additional at this time, we're going to hold this bill and wait until we have the amendments in front of us. Okay. All right. So we'll move to Senate Bill 52.
Okay, Senate Bill 52 as introduced, concerns the allowing, if the federal government ever says yes, it would authorize the state to pursue a waiver to allow SNAP funds to be used for diapers and menstrual hygiene products. Right now, SNAP, you can't use SNAP funds for anything but food. I guess there's some thought that maybe someday the federal government will allow SNAP money to be used for other products other than food, but right now that's not the case. There was an amendment offered by the sponsor, and you'll have a reprint in front of you. And the idea was to not to be just SNAP, but also to be WIC, which is the Women, Infants and Children's Program, which is also another federally funded program. So if either of these programs, if the federal government ever allows these programs, which are now only for food, to be used for other purposes, it would require the state to apply to the federal government for a waiver to allow these funds to be, because these programs are administered by the state. It would allow these funds also to be used for diapers and menstrual hygiene products. Also, there's an additional amendment, if on page 1 of the reprint, you'll see that Senator Hester would like to be a co-sponsor on this bill.
Thank you. So before we get to that, basically, just to make sure I understand, there's been conversations about potentially the federal government allowing these products to be paid for out of federal
Yes.
funds. So if this happens when we're out of session, we don't have to wait. They don't have to wait for us to come back. They could apply for the waiver and do it right then.
Yeah,
That's
but, yeah, if the federal government ever makes that policy change.
Correct. Okay, Senator Hayes.
Dave, there was testimony provided and you may have spoke to it a little bit in that SNAP is a DHS program and WIC is a health department program.
Yes.
And so that wasn't clearly identified. I think the sponsor in her testimony at the hearing said that that
Yeah.
was addressed in. the
Yeah, if you see the reprint, it brings in a part of the code that concerns WIC. And it says regarding WIC that if there's a change in federal policy, that the state should apply for a waiver to allow WIC
Yeah.
funds also to be
Okay.
used for
Thank you so very much.
these
Appreciate it.
products. So there's adding a sponsor and then bringing in WIC to the bill and then. Is there other folks who want to get on it?
Okay, so there was interest in co-sponsoring this bill. That's a big, high hand raise there, Senator. Tell us what you really want. Okay, anyone interested in joining the vast list of co-sponsors, raise your hand.
Okay,
All right, for the children,
A partisan group of
diapers.
sponsors.
Okay, that being said, I'd entertain a motion favorable with amendments. Senator Vital, second. Senator Reedy. All those in favor indicate by saying aye. Those opposed, raise your hand. That bill receives a favorable with amendments unanimous report. Is that
Okay.
it for you, David?
And then the last bill that I have here is a simple 2-page bill. There's no reprint. There were several, you all heard a briefing about the all-payer model contract. And there's one part of the code that wasn't changed to acknowledge that we are now operating under a all-payer model contract regarding the activities of the HSCRC. So a year or two ago, you made a bunch of changes to their law to recognize the all-payer model contract, but they forgot this one piece. So this is sort of corrective in that it would say that all the activities of the Health Services Cost Review Commission regarding hospital rates must be consistent with the all-payer model contract.
Okay, Senator Lamb. Questions? Anybody?
Yeah,
Questions?
question.
Yes.
Did you say, Mr. Smolsky, that there's amendments but no reprint?
No, there's no amendments to this bill.
No.
Okay. No, this is clean. It's
Okay. Any questions? Vice Chair says she likes this bill. Okay, I feel there's some energy behind this bill. Okay, tell us, Senator Hershey, what's your pleasure?
Would like to open it up for sponsorships.
Okay, let's open it up for a sponsor amendment. All those who want to be included,
Back to our districts and tell them all about the good bills.
I think that's everybody.
okay. So, all right.
Okay, the Vice Chair moves favorable with the sponsor amendment. Is there a second? Okay, a motion and a second on the favorable. All those in favor say aye. No one's raising their hand. That bill receives a unanimous favorable with amendments.
Thank you all. Thank you.
All right, we're going to turn to Senate Bill 202. Patrick?
Senate Bill 202, it relates to the Prescription Drug Affordability Board. What the bill does, an emergency bill, it reinstates provisions of law regarding the authority of the Prescription Drug Affordability Board to set upper payment limits for prescription drug products that have led or will lead to affordability challenges in the state. These provisions of law terminated on January 1st. And so the bill reinstates the upper limit setting authority of the board and related provisions such as an appeals process. As before, any plan of action for implementing the board's process for setting upper payment limits must first be approved by the Legislative Policy Committee or the governor and the attorney general. And if this plan is approved, the board would be authorized to set the upper payment limits for prescription drug products that are purchased or paid for by a unit of state or local government, paid for through a health benefit plan on behalf of a unit or unit of a state or local government, or purchased for or paid by Medicaid. There was initially a letter of concern that the health department had submitted, but after some conversation with the board staff and sponsors, submitted a new letter of information indicating that after conversations, some of those concerns had been addressed. Those concerns have been addressed.
I sense a sponsored problem. Other than that.
Are there any questions on the bill? Senate Bill 202, Senator Lamb?
Yeah, I just want to check with council. Is that updated letter in the folder?
Yes.
Yes, it is.
We had it by the hearing.
All right, thank you.
Any other questions? Entertain a motion. Move. I got a motion from Ellis and a second from Vital on the favorable. Any questions? All those in favor indicate by saying aye. Those opposed, raise your hand. That bill receives a favorable report. We have two bills on the back to address.
They're withdrawals. One's
Withdrawals.
the minimum wage.
Yeah, I'm happy to see we're not dealing with that this year.
Oh, sure, right. Okay, do we want to take them up as a consent calendar? Can we do that?
Different sponsor.
Move favorable.
I think that they suck the life
Move
out of
unfavorable.
everybody's like, forget it.
Vice Chair moves unfavorable on the withdrawn bills. You want,
I don't, unfavorable would mean we weren't gonna let them be withdrawn. Unfavorable withdrawn. No.
so you,
Favorable.
Yeah, it's an unfavorable.
it's unfavorable withdrawn. Thank you. No, it's okay. That's okay. We're all learning. Okay,
Well, I just think it doesn't mean-
okay, so
Okay.
those of you that are in favor of the unfavorable on the withdrawn bills indicate by saying aye. Any opposed, raise your hand. Those bills are reported unfavorable withdrawn. That concludes the voting session for today. Great week. Remember, we have on February 24th, that is our alcoholic beverage bill day. And the way that the bills are coming in, it looks like we may gather together on some Fridays before crossover to do some hearings and maybe some voting. So just wanted to get you all prepared for that inevitable use of our Friday afternoons. With that, meeting adjourned. Thank you all. Great work.